Hello and welcome to episode 8 of CMTV. I'm Aubrey going.
And I'm Alison Kavanagh.
So we've got a few different topics to talk about today. I think the one that's of interest to you is probably...
Water. Yes, water consumption, how much we should be drinking and why.
Yeah. I'm going to be talking a little bit about something quite topical coming up in our November seminar. We're going to be talking about neurological neck. So looking at some typical patterns of dysfunction that maybe aren't on everybody's radar. Important, but deep muscles can be quite interesting. We start talking about water?
Yeah, I'm quite interested in water. It comes up regularly in the clinic when clients are quite dehydrated. I see it particularly in their connective tissue if I try to do some skin rolling and it's really adhered and stuck. The tissues are notably dehydrated and invariably it'll feel pinchy and uncomfortable. And when you ask them, are they drinking water? They come out, they may say something like, I don't like the taste of it. Which seems a little bizarre. That
colourless, odourless, tasteless fluid I don't like the taste of.
Yeah, well, I know it can be variations depending on the area you're living in and so on. But I just thought it was important to mention the relevance of drinking water.
And it's kind of in the context of what we've started off talking about, where our dad used to talk about the answer to good health, the answer being an acronym. And we've talked about air, A-N, nutrition. We've touched on it. And sleep, we talked about last time.
Yeah, and W for water.
Water. So rather than hydration, water, because it kind of fits in with the acronym. Yeah. And that's going to be a whole section in the book that we're working on. Next publication that Alison's done a huge amount of work on. I'm just starting to collaborate with.
Yeah.
So what else then? I suppose some of the cold hard facts maybe?
Yeah, I think the fact that anywhere from, on average, 60% of the body is water, up to 70% of the brain is water. And particularly the fluid mediums that we have dissolved substances in our transport system of the circulatory system, up to 90% of our plasma is water. So we're essentially a bag of water in simplest terms.
Well, one of the things I was looking at as well was where you had detailed out the role that water plays in different systems of the body. And one of the ones that caught my eye was digestion. And it's literally from the very first step, like when you take food into your mouth and you start to break up the food with your teeth, you're also adding saliva. And saliva is actually 99% water.
Yeah.
So like if you think about almost like putting something in a blender, you're trying to liquidize it so that you can get the nutrients out. That very first stage of adding fluid, adding water is coming from the saliva. And we think of saliva as being something special, and it is in its own right, but it's 99% water.
Yeah, exactly.
And then even the mucus lining, as we swallow and food travels down the esophagus, that mucus lining is 97% water.
Yeah.
So like from those very early stages, you're trying to add fluid to nearly kind of dissolve, you could say, or make the particles freer. Liquefy is probably a better term. So that by the time it goes through the acid bath in the stomach, the alkali bath of the duodenum, that into the small intestine, stuff is watery enough that it's easier to extract the nutrients, the dissolved kind of minerals and proteins and everything else that we are absorbing from our food.
Yeah. So I was just particularly interested in the circulation as well, probably from a therapy point of view, that, the famous quote from Eunice Ingham, who pioneered reflexology, that, circulation is life and stagnation is death, that we need this flow in and flow out through the body. And the cells in the body are surrounded by tissue fluid, which can then become lymph. So tissue fluid, lymph, very similar in composition. Again, nearly 98% water, that the importance of water for getting rid of waste in the body and for keeping that flow in of nutrients as well as the removal of the waste, it's so hugely relevant.
Well, I think particularly in the bodywork industry, I mean, fascia has become such an important topic. Fascial research has really exploded since 2007 with the first Fascial Congress. But when you think about it, we oftentimes as therapists maybe think about the fiber component of fascia, but a huge amount of it is ground substance, which is, again, mostly water, because really all the cells are bathed in water and contain water. We just call it different things when it's in different places, which is kind of what you're saying about circulation. So when we take in water and it's absorbed into the body, if it's in a blood vessel, it's part of the blood plasma. If it's between the cells, it's interstitial fluid. If it's in the lymphatics, it's lymph fluid. But it's all water with different stuff in it.
Yeah.
You could think of it as like different cordials, that it's mostly water with a bit of color and flavor, and in this case, nutrients and metabolites and all kinds of stuff, but it's all the same water.
Yeah. Yeah.
What I always thought was interesting as well is when we talk to clients about their intake of water, even the people who might actually drink a reasonable amount of water, they still have areas that are dehydrated. So we talk about, again, in the fascia, there's a substance that's actually kind of becoming well known now because of advertising for beauty products that contain hyaluronic acid. Yeah. And it is that hyaluronic acid that is hydrophilic, which means it has an affinity or an attraction for water. So once there's enough space, it will actually draw fluid in like a sponge, pulling the fluid into the tissues, but only if it can get there. So I don't know if you want to talk about maybe some of the factors that you found that might inhibit that. Like, why is the water not getting there?
Well, I guess stuck tissues is one factor, and just physically not taking enough water in. So how much water is enough water? There's a lot of debate around this. There was the old saying of 8 to 10 glasses of water a day, but pure water, I'd say ideally about a litre is good to ensure that you're getting to keep tissues well hydrated. It's not factoring in fluid that we get from other substances like tea and coffee, because sometimes that's not counted because it's not pure water, but it is still adding to the liquid component.
Yeah.
The amount of water we drink also will affect blood pressure. So if people are dizzy or lightheaded, it's important that they drink water to bring up their blood pressure. So again, therapy terms, which we're often thinking of, is if they feel a little lightheaded when they sit up, if they drink some water, it'll bring up the blood volume, increase the pressure against the blood vessels, and in turn give an increase in blood pressure.
And it's funny how much those things are sometimes referenced, but unless there's an understanding of why, sometimes then people will go, oh, doesn't matter. Like in the therapy world, it's a big thing. Oh, drink more water.
Yeah.
Oh, make sure you give them water after the session. And unless you relate to why, you're kind of doing it by rote. And then you might go, well, I don't see the point in this, and you might stop doing it.
Yeah.
And it is that idea that you are maintaining volume, which helps to maintain blood pressure. Because when you relax, we see this a lot in therapies, everything, including the blood vessels, dilate. So if you have the same volume of fluid, but you increase the space, the pressure goes down.
Yeah.
We see the opposite when we put air in a tire in our car, because it's a fixed volume, the inside of the tire. But when we add more air into that fixed volume, it creates pressure.
Yeah.
We read that as tire pressure.
Yeah.
So we see the opposite. We see that kind of drop. And unless you relate to that you're actually adding fluids to maintain blood pressure.
Yeah. And
but also to
flush out the toxins, which is another famous saying, what toxins?
Which is the second part of that.
Yeah. The metabolites, the natural byproducts, or even stuff that was caught in restricted tissues that now has a chance to be carried away in the lymphatics or the blood circulation.
Actually, I remember Bernard McFadden, who kind of started the health culture movement in the US, would have had a very similar opinion. Stated it slightly different to Eunice Ingham, where Bernard would have said, all illness in the body is constipation. And he didn't mean digestive constipation. He meant sluggishness, the same thing. A lack of flow, a stagnation within the tissues. So I oftentimes think when we talk about like a tissue getting stuck, I think of the little fine blood vessels, the capillary bed in those tissues. And if the fascia gets very stuck, it can compress. I mean, it's not cutting off. If it did, you'd develop gangrene and you'd
necrosis,
septicemia and necrosis, and you'd could be fatal. So it's not cutting it off, but it's reducing the flow, reducing the hydration. And I always think of that kind of the ground substance, that kind of fluid base with stuff in it that surrounds the fibers of the fascia, as being like wallpaper paste. So it's that if you have dehydration and a lack of fluid, it becomes kind of thick, almost like a wallpaper paste as it goes off. But then if you can add fluid back in, it goes into a more liquid flowing type state. And oftentimes the dissolved compounds, again, I kind of use the analogy of, I think you're going to talk a little bit about seawater, that when they are trying to create sea salt, they have put them out in these shallow pens to evaporate off the water, and what you're left with is crystalline salt. That is in solution in water. And if there isn't sufficient water, it kind of falls out of solution. And this is where it becomes more thick and paste-like. Yeah. So if we can move the tissue, we can free up the pressure on the capillary bed, we get better delivery of fluid in. The hyaluronic acid can then attract it in, and then everything becomes more flowing again.
Yeah, absolutely.
Yeah.
And I think some of the things that people don't realise is that you are actually losing liquid or vapour in the form of even just breathing. There's a certain amount of water vapour being lost. Obviously sweating, so for exercising more or in a warmer climate, we need to increase our water intake. And for people that say they don't like the taste of water, you could look at adding something to the water, like lemon juice. Even though we consider it citric acid, quite acidic, it becomes alkaline as it travels through the body. And first thing in the morning, a glass of water with lemon in it. Some people like to add some apple cider vinegar to it, that it'll have a high level of potassium in it, which is really good for getting rid of cramps if it's caused by potassium. So again, clients coming in saying getting these unmerciful cramps, and as they're drinking the water with half a cup of apple cider vinegar in it, the cramp starts to resolve. So there's the relevance of how much you're losing. You don't realise that you're losing it just as you're talking and as you're breathing, and then what you lose through the skin in sweat and temperature, that does need to be replaced. So as I said, the kind of rough guideline of the 8 to 10 glasses or about a litre of pure water a day, and put something in it if you need to get a flavour into it.
Yeah, it's interesting. Like, I think we only really see it like in cold weather where you can see your breath. It's the moisture in your breath that you're seeing.
Yeah.
We don't see that in warmer weather, but we're still losing a lot of moisture just through our exhalation.
Yeah.
Because the lining of the lung is much more moist than the external air. So we're breathing out and losing some of that moisture with every breath.
Yeah.
Okay. I thought that was interesting when we talk about like kind of temperature regulation, how blood is really circulating through the warmer organs and then carrying that heat to the surface of the body where we can radiate it away. So water is important in terms of the fluids that are circulating. But then, as you said, sweat, as we produce water through the pores in the skin, sweat, it in the process of evaporation is carrying away heat. And of course, because it's a great thermal conductor, when your skin is wet, I mean, you always feel the cold more. Any little breeze or anything like that, you're going to feel it more. So it's actually working in a lot of ways, water being a key component in helping to regulate temperature, particularly getting rid of excess heat. Cellular metabolism as well, we said. So cells need food and oxygen, and they're going to produce carbon dioxide and waste. So almost like a miniature of the human body. And it needs that flow in and flow out. We need fluids to carry in the essential components for the life of that cell. It's going to go through its normal metabolic processes, and it's going to produce waste material as a result. And that waste has to get out. So we have to have enough fluid to dissolve that and carry it away. So even at the individual cell layer, and even inside the cell, which I always find fascinating, they talk about like miniature organs, organelles, that kind of mimic a lot of the functions of the different organs within the body. Each of those has their own processes that they go through, but they are bathed in a fluid as well, the cytoplasm. So we've got fluid in the cell, fluid outside the cell. We've got all of this dynamic exchange of fluid hopefully taking place to keep everything healthy. I oftentimes think if you visualize something like a body of water, like I always think like a small lake, that you can actually see the boundaries of the lake. And if you actually picture in your mind a lake, nice sunny weather, hopefully, you're standing at the side of the lake enjoying this beautiful scenery, and visualize kind of like a flow of fluid through the lake and how full of life that lake will be when there's a good flow of water. That you'll have lots of marine life, you'll have frogs and insects and all kinds of things in that living, vibrant environment. And then you think about something like a stagnant pool of water, where there's no flow in or flow out. Eventually the oxygen goes out of that water, it cannot support life. It oftentimes becomes, unpleasant odors. It's, it's
swampy.
It's swampy, that we don't want our body to be a swamp. We want to clear the swamp. So we want to have a dynamic exchange of fluid. So a flow in and flow out. That's why I think of the lake, because lakes will invariably have some tributary feeding into them. And then there will need to be an outflow as well. That they are just almost like a cistern, a storage or a body of water on the path of this journey. And that's kind of what we are as individuals. We need to have a flow through. Because it's not constant, we oftentimes don't appreciate it. And I think then the other thing we were talking about was elimination of waste as well, because I think digestive upset is a big thing for a lot of people. So people suffering particularly from constipation. And a lot of that is down to the fact that maybe too much fluid is being reabsorbed in the large intestine, because we've talked about the small intestine and going through the process of chewing and adding fluid, we're taking back a lot of that fluid in the late stages.
Yeah.
So then factors that are going to influence that, how much is absorbed, how much is retained?
Yeah, I think obviously the type of food we're eating is going to be a factor. The health of the gut lining is a factor, and that we're feeding our good gut bacteria. So that we're getting, they reckon, maybe 30 different fruit and vegetables a week to feed the healthy gut bacteria. So it's kind of a combination of healthy gut, foods that feed the microbiome, and then drinking enough water, that there is enough fluid flow through, that it doesn't get too concentrated and too slowed down from lack of fibre and what used to be called roughage. So we need different types of fibre. We need soluble fibre that will feed the gut bacteria, because if they don't do that, they start eating the lining of the gut, that mucous membrane lining. And then we get these perforations or these gaps in the tight junctions. Then some of the products can get through untreated, and the immune system is triggered to then attack those products.
Yes, the kind of food sensitivities and immune response that we've talked about back in some of our earlier episodes.
Yeah, even the histamine response, that it can trigger the body to produce high levels of histamine. So we're overreacting to pretty ordinary foods just because they're not being filtered by the gut lining.
I think fortunately there's much more of an understanding now of what healthy fibre should be, because certainly back in the 80s and 90s everybody thought fibre had to be from like bran and things like that.
Really coarse.
Whereas those are coarse fibres that sometimes interfere with digestion, that really when we're talking about fibre, we're talking about fibre from vegetables mostly.
Yeah.
And fruits to a certain extent.
Yeah. So like things like seeds, chia seeds, which actually hold a lot of water, they're quite useful. Things like linseeds or flax seeds are very useful, and even to soak them overnight in water, and this kind of egg white consistency.
Almost like mucus.
Mucoglucopolysaccharides, that kind of chain of egg white consistency, and maybe to use that in smoothies rather than throw it out after the water has been used to soften the seeds. So things like porridge have good levels of, oats have good levels of soluble fibre, aloe vera is another good source, the chia seeds, all of those kind of things. So it's helpful for the lining and helpful for feeding the good gut bacteria to protect us from, protect those tight junctions and stop things filtering through that shouldn't.
And the last thing I wrote down was mobility as well. And again, this is probably something that we relate to particularly as body workers, that when tissue is dehydrated and becomes more kind of stuck, it makes it more difficult to move. And in the process, not only does it kind of compress the capillary bed, but it can kind of compress small nerve endings as well and cause low-level nervous system irritation. And so if you don't move frequently enough, those areas can become dehydrated, and then it becomes a bit of a snowball effect, that because it's more stuck, you move less and you have more discomfort when you try to move. That I think either through variety of movement, or we oftentimes talk about body work kind of breaking the log jam, that it frees you up, that it's easier to move, it feels better when you move, and then you can maintain that well yourself. But even movement can be influenced by how well hydrated your tissues are. So if you have aches and pains, if you find your mobility isn't good, one of the factors might be, are you taking in enough fluid overall? Because I came across an article recently where they used to say tea and coffee doesn't count because it's mildly diuretic. Whereas now it's being more recognized that they'd say, well, these are fluids. Obviously they're creating some hydration, but obviously just water is going to be the ideal. So it's not that you have to give up your tea and coffee, but make sure, as you said earlier, that you're drinking at least a litre of just water is making up at least some of the fluids that you're taking in. I mean, ideally, if we only drank water, that'd be the perfect world. But even if we just have a litre of water in addition to our other fluids, we're not saying only take in a litre of fluid within a day. We're saying try to get at least a litre of your fluids just from plain water. Or like you said, water with something simple like apple cider vinegar or a squeeze of lime or lemon or something.
Pinch of salt.
Okay, anything else you want to say about water?
No, I think that pretty much covers it.
Okay, so I was going to talk a little bit about the neurological neck, which is kind of the title of the section of our November seminar that I'm teaching. We also have our guest presenter who we've interviewed back in episode 5. James Waslowski is joining us here in Dublin in November. It's the 2nd to the 4th. Great opportunity for you to upskill if you are a body worker, and can lead on to a level 5 sports massage qualification. So we're kind of our highest level of sports training. But the thing I wanted to talk about in particular is a muscle, or rather two muscles, that are often overlooked because they're small, they're deep, and they're not very strong power movers, but yet they do cross vertebrae and they link kind of segments of vertebrae. We've talked quite a bit in the past about a muscle that I think is quite important. There was an Australian research group looked into this as well, as, you know, they were looking at what is the core, and they talk about the core and the trunk of the body. Yeah. And they were saying one of the muscles that actually lies deep in the back is a muscle called multifidus. And you can check out some of our multifidus stretches on our YouTube channel. But multifidus kind of goes from the spinous process of one vertebrae to the transverse process of another, or sometimes covers 3 vertebrae, like it's not always just 2, sometimes it's 3. When we look at longus capitis and longus colli in particular, it has a similar arrangement. It kind of goes from bodies to transverse and from transverse to bodies. It changes over around C5, which is quite interesting. So it could be seen as like the multifidus on the anterior surface of the neck. Now, this muscle is deep, so we're going to talk about how to work this in our seminar, because we're going to be looking at some side-lying techniques, which I think is going to be really good. It's going to give us a lot of treatment options for introducing a lot more movement when the client is side-lying. So we'll be doing like our old favorites, but with a different twist, a different positioning, where we'll be releasing from the top layers down. We'll be doing platysma, then we'll be doing sternocleido. We'll get into scalenes. Really easy to access the attachment of scalenes from that side-lying position. But then from supine, we're going to look at how do we displace the trachea and get back onto the anterior surfaces of the bodies of the vertebrae, which sounds like it's going to be quite invasive, but it's really not uncomfortable. No. They're much closer to the surface than you think, so it's not that deep. We'll talk about safety concerns as well, obviously, how to recognize the signs if you're too close to blood vessels or lymph nodes or nerves or anything like that, so that we're able to work very safely. But what we've found, I think you were saying you've come across this recently in clinic as well with a number of people with neck issues, that when you get a good release by working onto getting down to the point that you can contact longus colli and then longus capitis and introduce some movement, it really does help to just calm the nervous system, let those muscles relax and free up any adhesion that might have occurred in those muscles. And then because it's controlling like movement between spinal segments, it can really help to decompress the parts of the cervical spine, like C5, C6, C6, C7, the ones that normally, if there's going to be a bulge on the disc, if there's going to be a herniation, it tends to happen at those levels. And that can cause problems into the shoulder, the arm, the hand. It can mimic things like golfer's elbow or carpal tunnel when it's not actually coming from those areas. It's coming from back up in the neck. So by treating these 2 deep muscles, which we're going to do in depth in this seminar, we can really help the cervical spine to decompress, to get back what we'd call vertical dimension. It can regain some of its height. And get movement back as well. So a lot of people find that things start moving a lot better. And then once we've done that, obviously, we'll look at how to open and close the different facet joints and make sure that the joints are actually moving properly. I think that's a key factor. Just I found where I was using kind of the standard protocol, the overarching principles, working superficial to deep, releasing tight muscles before addressing weak muscles. And even though you get a good release on scalenes, I found it was returning. And when I did the release for the longus colli and capitis, it just seemed to calm the nervous system as well. So I don't know, is there some correlation with the vagus nerve or something traveling through the area? Because it just seemed to unlock the condition, even though it was responding really well to the standard protocol. It was like that missing piece that just resolved the whole thing and calmed the whole nervous system down. And we've talked about this before, that if we leave an element of the client's condition unresolved, you'll oftentimes see that the same protective guarding reestablishes
over time.
Sometimes in days, sometimes weeks, sometimes months, but the same pattern is going to reoccur. Whereas if we can really free everything up, if we can get to the nub of the problem, then the nervous system is happier, joints are moving better, and the condition doesn't reoccur, provided the client is doing their home care.
Yes,
Always a key element.
Good.
One other thing I think might be worth mentioning was we've had a couple of people comment on some of our videos, either on YouTube or on Spotify, and we will get to those questions. What I wanted to touch on today was self-care for people who have had a pelvic torsion. So a torsion is when we get a twisting in the pelvis, and we teach this on quite a few of our seminars, how to, in the treatment session, bring that pelvis out of that twisted position to undo the torsion. But to maintain that, we have some simple clips. So there was really two clips, I suppose, I'd draw people's attention to. We might even put in segments here. So back in February 21st of this year, we posted a video on stretching psoas and multifidus, actually, seeing as how we're talking about multifidus. So we'll pop those in here as well. We'll take a quick look at those, but you can also find them on our social media. And then going back to mid-23, it was the 12th of July, we had one, a self-mobilization technique. So let's take a quick look at those two videos. Psoas is probably one of our most important hip flexors, prone to being short and tight, and when it is, it can really compress the lumbar spine and add an awful lot to lower back pain issues. So like TFL, I'm going to be lying on my side. I'm going to pull the knee up so that I'm protecting my low back and I'm protecting my pelvis. I'm going to take a hold of the foot, but this time instead of pushing the knee towards the floor, I'm going to reach back. 1, 2, and relax. Now, if you feel this more in your thigh, that's okay. It just means your rectus femoris, the hip flexor that's part of our quads, is a little bit tighter than psoas. Changing the angle of the leg can help. So if I bring my knee a little bit higher, I tend to get psoas a little bit more. Think about the thigh as acting like an arrow pointing towards the spine. If it's pointing towards your lumbar spine, you're really getting psoas a bit more directly. So again, when we reach back, we're holding for 2 seconds, and then we relax, and we just do 10 repetitions. So let's try that again on the other side. I'll change ends so you guys get a different camera angle. So lying on my side, I'm going to pull the knee up towards my chest, reach back, take a hold of the foot, and like our TFL stretch, we would say if you're getting pain in your knee, you could put a roll towel in. If you're finding the movement, the range difficult, you could use a stretch rope around the foot, which takes some of that bend out of the knee. Pull the lower leg up towards your chest. Then with the top leg, we're going to reach back as far as is comfortable and relax. Reaching back, holding for 2 seconds and relax. So each time we reach back and hold for 2 seconds, that counts as 1 repetition or 1 rep. If I'm not feeling that so much into the pelvis, if I'm feeling it more down into the thigh, I can lift the leg a little bit higher, which makes it more of a psoas stretch. As the knee comes down closer to the floor, we change amongst the different hip flexors. So at this kind of elevated position of the knee, it's more directly targeting psoas. And that's our final 10th rep. Excellent. Let's move on. Multifidus is a small but really important deep muscle in the back. It sits in the lamina groove, which is the part of the bone between the transverse processes of our vertebrae that sticks out to the side and the spinous process that sticks out to the back. So we have a band of muscle going down each side of the spine, and this is a 4th layer muscle. It's quite deep. The reason it's so important is because it connects one vertebrae to another, and it involves or controls small movement between those vertebrae. When it gets short, tight and dysfunctional, it can oftentimes start to lock down vertebral segments, causing facet joint dysfunction. So for this stretch, we're going to do a combination of flexion and rotation. If you don't find it comfortable to sit on the floor like this, you could equally perform this exercise in a chair. But this is a nice transition from some of our other stretches. So Ali, what we're going to get you to do is you're going to flex forward and rotate. So you're going to lean forward as far as is comfortable, and then we're going to position the hands. Let's get you turning towards your right side first. So you're going to put your right palm on top of your thigh. This is going to help push to rotate. This hand, the lower arm, is going to grip on the lower leg, which is going to help Ali to twist. So you're going to turn the shoulders as far as is comfortable. 1, 2, and ease back. Twist, 3, 4, and ease back. Now, if you count reps for me, Ali, you're going to count up to 10. So again, my habit is to count in 2s because I'm counting seconds, but you can equally just count the number of times you perform the exercise. Now, the more you flex forward, the further down the back you're going to feel this. So you can really tailor this exercise to suit yourself. If you feel this more in the shoulders, round your upper back and drop your head, but keep your lower back more vertical. Do the same twisting motion, and that will get this part of the back. If you want to get more into the mid or the lower back, you simply lean forward further to target each of those positions. Good. How are we doing on reps, Ali?
Good.
It's about 10 there?
Yeah.
Okay, let's do the other side. So straightening back up for a moment. We want to think about, if we want to get more of the upper back, you're going to tilt your head forward and just roll your shoulders a little bit to there. Good. I think Alison probably needs this a little further down the back, so we get you to roll forward a little bit more, coming into mid and slightly lower back. Again, this hand is going to grip the lower leg. This one is on top of the thigh, and you're going to rotate your shoulders. 1, 2, and relax. Good. Twisting. 3, 4. And remember, it's an active movement. The hands are only acting as an assist. It's a gentle pressure. It's actually the muscles of the torso that are doing most of the movement. When we activate the muscles in the back, we inhibit the target muscle and get it to relax. So we're really helping multifidus to lengthen and stretch because the nervous system is telling it to relax. That process, as we've said before, is called reciprocal inhibition. As one muscle is contracting, the opposing muscle must relax. That's good. So counting up to 10 repetitions, rotating as much as we can, twist, good. Oftentimes as a therapist, we can assist with these stretches. We're not forcing the client, we're just enabling them to go a little bit deeper where maybe the muscle that's doing the action isn't quite strong enough to overcome the muscle we're trying to stretch. Good, that's great. Thanks, Ali. There's basically 3 different structures that can contribute to chronic low back pain. The SI ligaments, the iliolumbar ligaments, and then lumbar facet dysfunction. So these 3 areas of the back are common pain generators. If you have pain in this first area, SI joint dysfunction or pain, here's a simple home care technique you can do to help alleviate some of that stress, but you should still see a therapist. So just sitting down in a chair, you're going to practice pushing one knee forward and then the other. So as this knee comes forward, you're rolling your pelvis. As the other knee comes forward, you're rolling the pelvis the other way. You're actually rocking your pelvis back and forth. So this is helping to mobilize your SI joints and help to hydrate the joints because you're stimulating synovial membranes. So you're oiling the joints, but you're also helping to create some movement, which takes some stress off those ligaments, which are the real pain generators. So looking at your knees, push one knee forward, push one knee back, alternate between the 2. And remember, you don't have to be sitting at home to do this. You can do this sitting in your car as well. So quite a simple little mobilization, just thinking about, I think, the visualization rather than thinking about what your hips are doing, thinking about pushing that knee forward and back to create that mobility. I think that's a great way for clients to just maintain some movement. Because again, like we said, if you don't move it, you lose it.
That's it.
Yeah, keeping a bit of motion in. Okay, anything else we need to cover?
No, I think that's pretty good for today. Looking forward to continuing with the other aspects of the answer to good health.
Yeah, and we'll be touching on some of the other questions. We had a question about the lymphatic system, and there was a couple of questions around that. So we'll probably get to those in the next episode. So stay tuned for that. But again, be sure to let us know if you have particular topics or questions, things that you'd like to hear us discuss on the podcast. We're more than happy to chat about those things.
Yeah, ask us anything.
Yes. Thanks for watching, folks, and we'll see you again soon.